Hello, viewers. Hello, Zimbabwe. Masquerade. Very good evening to you. Oh, Salibona Nama Zimbabwe. Amahle. Welcome to Africa and Beyond Television Network. Wenyu Ronald Makosha ndiye ari kunge achikurukura panguva ino. Ngatitaureika pamusoro penyaya yekuvharwa kwezveutano munyika yeZimbabwe. President Emerson Mnangagwa has managed to punish the hospitals, the officials, as well as the patients in the nation of Zimbabwe. Why do I say so? If you go to the cancer department, there is no functional cancer machine in the nation of Zimbabwe at this moment. If you go to very important hospitals in the nation of Zimbabwe, there are no critical drugs. Let me get into this video so that you understand what I am referring to here. UBH has done its worst at this moment, and let's get into this story.
Zimbabwe healthcare system is in intensive care after one of the biggest referral hospitals, United Bulawayo Hospital, has suspended operations because there is no medication to put patients to sleep. One of the drugs called ketamine cost only $50 a vial, yet government has failed to provide it. Let's get into this story. This was a letter which was wrote by the United Bulawayo Hospital management, which they copied to all consultants, all doctors, and all wards. The reference to this letter was the cancellation of elective lists. Due to the lack of anesthetic induction agents, elective lists have been suspended with immediate effect until further notice. Patients may buy their own drugs if any elective list is to proceed. Thank you. That was signed by Dr. T. Mushawarima, who is the acting director of clinical services at United Bulawayo Hospital. The letter was also copied to acting chief executive officer, all clinical HODs, and all directors. This letter is dated 18 July 2022.
So if you haven't been operated in the nation of Zimbabwe, it will be difficult for you to understand this. If your relative was never operated in the nation of Zimbabwe, it will be difficult for you to understand this. But honestly speaking, the health workers, they are being punished by the president, by the failure of the government to provide the key needed drugs in the hospitals. As I always say here on this platform, some people believe that I hate the government, but I don't. I always speak about lack of drugs in the hospitals, and you have seen the letter. I've presented the evidence. The letter which was written today by the United Bulawayo Hospital management, where they said that they are no longer going to provide operations to their patients because there is no drug. This drug costs $50. It means that for a patient to undergo an operation, they just need this drug which costs $50. $1.50. That is the drug, the cost of the drug, one drug. Which means if we are to go to the hospitals around Zimbabwe, you would see that that is affordable if the government is serious about these issues. If the government is serious about lives of people, that is much affordable. And we cannot have a government which buys tender, fire tenders at 450,000 each. We cannot have such a government telling us that they don't have money. So you can actually see that this is massive gross incompetence by the people who are in charge. If you go to the president, he has failed to deliver affordable healthcare for everybody. He has failed to that regard. If you go to the minister, he has failed to allocate the much needed monies to the Ministry of Health. If you go to the Ministry of Health itself, it's because there is a man who is not a doctor, who knows nothing about these issues, who is appointed also as a minister. Go to the permanent secretary. This is a former soldier who is attached to that ministry, who knows nothing about health. This is just somebody who just had an opportunity to become a doctor through various illegal strategies they use to become doctors, and that is the permanent secretary we have. We don't have competent people at the Ministry of Health. We don't have competent people in the Ministry of Finance and basically in the executive. That is the reason why you see the economy doing like this. That is the reason why you are seeing everything going offside. And this is a cause of concern. I have shown you the evidence, you have seen the videos. Tell me in the comment section, how do you see this issue? What do you say about this whole issue? That is why we are always saying, let's register to vote. Let's do the needful. Let's make sure that we prepare ourselves. Let's make sure that we vote out this incompetent, clueless government. Let's have change in the nation of Zimbabwe. We cannot have a hospital without the basics. Very, 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 very needful basics. They are not there. So what kind of government is this? No salaries for doctors and nurses, no salaries for health workers, no drugs in the hospitals, no beds for the patients, no proper food for the patients, nothing. Yet you promised to have world-class health facilities in the nation of Zimbabwe. And the question is, for the past 5 years, what have you done? Nothing. Let's register to vote and change the status quo in the nation of Zimbabwe. We cannot continue to have our relatives die, to have our people dying each and every day. Let's act timelessly. So thank you very much for coming. Thank you very much for supporting. Got subscribe, got like, comment, and share so that till we meet in another episode. Thank you very much. My name is Ronald Hukomakusha.